Okay, everyone. So you're very welcome to join us tonight for Let's Talk About Sex. And it does what it says on the tin. We are going to talk about sex, mainly sexual health, but other things may arise. We're up for that as well. So I have about 8 sexual health questions that I'm going to put to our resident sexpert, Leo Lardie, who is our sexual health officer in the Rainbow Project. And hopefully Leo is going to clue us in on the answers to these questions. If you have questions yourself or if anything arises for you, make a note of it and we'll make time at the end and you can ask those questions. Okay, so if you bear with me, I'm just going to change the view for the camera. And it's on Leo's handsome face right now. So
Lovely.
thank you. Leo, thanks for agreeing to do this. I know you've been on Zoom all day, so I'm quite tired out by all of the talks. Question one. So I'm from an era which is from the first time around the explosion of what we only knew as the AIDS virus and all of those dreaded adverts with the tombstone and AIDS, don't die of ignorance. And so my question is kind of from that era, because back then HIV wasn't really talked about, wasn't known about, it was all AIDS. So the first question is, can you tell me what the difference is between HIV and AIDS?
Well, it's so basically HIV refers to a virus. AIDS refers to a condition. So HIV stands for human immunodeficiency virus. And basically what that virus does is it attacks your white blood cells so that your body is not able to heal itself, to protect itself from infection. When HIV progresses to the point in which you have very, very, very few white blood cells, then it is classified as AIDS, which is, let me get this correct. So that's autoimmune deficiency disease, I think. And so basically, AIDS is the point at which you're no longer trying to control the virus and to stop and to slow the progression towards AIDS. It's when you now have to treat the body more aggressively to protect it from we call opportunistic infections, things like tuberculosis, pneumonia, anything from like a chest infection to a cold can be quite dangerous for someone who has AIDS. Really, it's difficult to measure, but I think what they generally say is that you're diagnosed with AIDS when you have less than 200 white blood cells, a white blood cell count. Really, HIV is not the disease that it once was. You've already mentioned the HIV and AIDS epidemic of the late 80s and early 90s. And back then, HIV and AIDS were kind of synonymous with each other. And that's because there wasn't really a whole lot of treatment that could slow down the progression towards AIDS. And in fact, they really didn't know a whole lot about the condition generally. So HIV now, someone who's diagnosed with HIV today has the same life expectancy as someone who is HIV negative. And whilst before it was very, very common for someone who had HIV to develop into AIDS after a period of time, that period of time is now being prolonged. So there's people who have been diagnosed as HIV positive for decades now and still have not progressed into getting AIDS. And that is really quite common right now. The medication that is used to treat HIV, which is called ART or antiretroviral therapy, can do a lot to protect your body, to make sure that your white blood cells are not being lowered, that the progress of the virus is slowed, and that your body has time to heal and to protect itself. And it also somewhat lessens the opportunity for it to be passed on to other people through sexual transmission. Not entirely, but just lessens it slightly. So really the difference between HIV and AIDS is severity and time. HIV is a virus that you can treat. AIDS is a condition that you will have for lifelong, and that you will have to take different medication for to protect you further, basically.
Thank you so much, Leo. Beautifully put. So it's HIV is the start of the process where the virus gets in, it starts attacking the immune system, and now with the medications, it doesn't have to progress to AIDS. It can stay at the HIV stage and it can stay at a level where you're not really passing it on.
Yeah, and I have even known people who have had really, really low blood cell count and had still not been classified as AIDS because the medication that they were using made their body able to kind of reinvigorate itself and to slow the process of the virus and also to repair itself slightly. So there is even opportunities when someone does have a really low T cell count that it can regenerate again, but it's very much different for every single person.
Great, thank you. So next question, Leo, is in terms of our community, the LGBT plus community, what sort of activities will put us most at risk of infection?
Well, I mean, for sexually transmitted infections, the riskiest type of sex you can have is anal. Unprotected anal is really the riskiest one, and I'll tell you for why. STIs are generally passed through blood and bodily fluids, and bodily fluids are cum, pre-cum, anal mucus, vaginal fluids, and breast milk. I don't think many people are using breast milk in a sexual sense, but you never know, so it's worth saying. So if any of those, if any blood or bodily fluid that's coming from someone who has an STI gets in your bloodstream via a small cut or wound, then that person might develop that STI. So when we're talking about anal sex, as we're probably all aware, the anus is a small, tight, dry canal. It doesn't self-lubricate itself. And for some people, if you're going in without lubrication, you can cause a cut or an injury while you're down there just from the friction. And also, I don't know about the rest of y'all, but I really don't, I'm not aware if I've ever got like, if I've got a cut or a wee wound or even just an open blister in my anus, I might not actually even be aware of that. So you might think that you don't have any open ways into your bloodstream via your anus, but you might not be 100% certain. And that is why anal sex is probably the riskiest type of sex you can have. So ways to kind of counteract that is to use plenty of lubricant. It is to always use protection unless you and your partner are getting tested regularly, or perhaps you're monogamous, or you communicate to each other that if you're having sex outside of this relationship, that is protected. And there's also things like PrEP that you can take, and also PEP you can take 72 hours after sex to protect you from HIV. But really, when it comes to STIs, you can really get it anyway. I'd say probably the safest type of sex you could possibly have is oral sex. It is really, really very, very, very rare to get HIV from oral sex. And that's just because when you're doing oral, really the penis is at the back of your throat. It is not in and around your teeth. So when the person ejaculates, that pre-cum is usually either being swallowed immediately or it's being spat out. It doesn't really have time to sit there and fester. I don't really know many people who sit with a mouthful of cum. I don't really know anybody that does that. Oral sex.
It has the entire stomach and digestive system of defenses to get through before it can do any damage or before it can get into the bloodstream.
Absolutely, and really, it's just so uncommon. Like I always try to find a very specific number of people who've contracted HIV from oral, but it's like 0.00001%. It's so hard to calculate, and really, let's talk other things other than HIV. Other than HIV, there's things like syphilis, gonorrhea, chlamydia, herpes, genital warts. And all of these STIs come with their own problems. Probably not as many of them are as a chronic or a lifelong condition as HIV, but they can still be pretty irritating and annoying to have. And I know for some people getting an STI, it feels like a real mark against them that it's, that they're dirty, or that they're unclean, that they're gross, or things like that. And when it comes to STIs, any blood or bodily fluids that can get into your bloodstream can cause an STI. So we're always talking about using protective measures, whether that's condoms, lube, dental dams, But also it's about sometimes especially using your common sense. So whilst we'd say, you know, oral sex is the safest type of sex you can have in regards to HIV, there are some things that can specifically affect oral sex. And those things are syphilis, herpes, and genital warts. And these STIs, they can all have physical symptoms. So at the very beginning of syphilis, there's a painless sore. With herpes, there's like a rash that happens in and around the genitalia. And with genital warts, it's warts. And when those symptoms are visible on the body, they're actually quite contagious to the touch. So if you were to touch somebody's herpes rash with your bare hand, and then touch a really thin part of your skin, like your eyes, your eyelids, your ears, your nostrils, your lips, even the top of the penis or vaginal glands, that STI can transmit through that really thin skin and give you that STI without any blood or bodily fluids exchanged. So what we generally say at Rainbow is if you're going to have oral sex unprotected, generally that's fine. But if you're pulling down the trousers and you maybe see a rash, a blister, a wart, you might want to ask that person, have they been tested recently? Maybe we should use protection, because if your lips touch those physical symptoms, then you could get that STI. So really, the safest sex to have is oral sex. But if you use protection, if you're using condoms, lube, dental dams, or even PrEP and PEP, then that risk is really very limited.
Thanks, Leo. Next question is about PrEP and taking PrEP on demand. So for people that doesn't know, PrEP is a preventative, prophylactic drug that you can take. And we have a wee guide there demonstrated by Leo.
It's great.
And it will help prevent infection from HIV. Some people take it as directed on a daily basis if they're having regular unprotected sex, and that's what it's recommended. But some people also take it on demand, and that's a few tablets on the day, hopefully the day before, if you know you're going to have sex on the Friday, for example. So you would take 2 on the Thursday, 2 on the Friday, and 2 on the Saturday after, just to prevent. So that's PrEP on demand. Do we know much about the safety of that yet, Leo, or is it still too early?
Well, the good news is, so this guide that I've got here, you can actually get this online for free. You can order one to arrive to your house, or you can just read it online. It's at IBIS, just Google UK Guide to Buying PrEP. It's got everything you could possibly need to know about buying PrEP privately, which is really the only option right now, due to the PrEP clinic being closed due to COVID. I do believe that Altnagevan and Derry is still running their PrEP clinic, but if you're wanting to get PrEP right now, you're going to have to buy it online at iwantprepnow.co.uk. And so this guide basically says that it kind of puts in all the information you could possibly need to know in a really easy to read way. And before PrEP kind of came out in the mainstream, there was hundreds, probably thousands of trials done across the globe in terms of PrEP and its effectiveness, both on different types of people, men, women, trans people, and also the dosing. So people taking the everyday pill and some people doing event-based dosing. And generally what they say at IBS is that it is over 99% effective at limiting HIV risk. So whether you're taking it every day or doing event-based dosing, you can be pretty goddamn certain that you're not going to get HIV. And event-based dosing is actually a really great way to stretch your pills for a longer period of time, especially if you're buying them online privately. If you are taking a pill every day but not having sex every day, you're basically wasting medication you've paid time, medication you've paid money, your own good money for. So event-based dosing is actually really effective. As long as you're taking 2 tablets at least 2 hours before you're having sex. Ideally, it would be 24 hours before, but at least 2 hours before provides perfect amount of protection. And then you're doing 1 PrEP pill 24 hours after sex and another dose of pill 24 hours after that. And that's completely effective at over 99% effective at stopping HIV. So somebody who's on PrEP, whether event-based dosing or they're using a daily dose, can be pretty dang confident that they're not going to get HIV.
Thank you, Leo. And so that's PrEP, the preventative, and then there's also PEP, which is post-exposure.
Mhm.
So if anyone has had uh, unprotected sex and they're not sure of the status of their partner and they're worried they may be at risk of infection, they can go to A&E.
Yeah, so PEP, or post-exposure prophylaxis, I guess it makes sense that one of them is called PrEP, as in preparation, and PEP is like post-exposure, so after sex. But it does make it really difficult for the layperson because they sound so similar. And oftentimes I'll say, "Have you heard of PEP?" And they'll go, "I PrEP." Like, no, PEP. So PEP is about a 28-day course of medication that you take every day, that can highly eliminate your risk of getting HIV. It's not always effective, but it is very effective and worth taking. So really, if you've had unprotected anal or vaginal sex, maybe the condom broke or fell off or snapped, maybe a condom wasn't worn, or maybe you're not actually quite certain if you wore a condom or not, and you're concerned you could have got HIV from that encounter, you can go to any accident and emergency in Northern Ireland and just ask for PEP at the counter. A doctor or nurse will take you aside after probably waiting a bit to do what's a short sexual history. So when was the last time you had sex? What type of sex was it? Who was it with? Kind of basic questions that we would ask in our own testing service. And from that, they assess your risk and decide whether it's worthwhile to give you PEP or not. It's worth mentioning that PEP can cause some side effects, but they're very, very mild. Some people talk about getting like flu-like symptoms, so feeling really tired, really fatigued. Some people get like pain or muscle soreness. And some people even get like things like diarrhea and nausea. But most people say that those side effects subside after the first few days. And really, when you consider it on balance, it's not the worst thing to go. If you're going to have a few days of an upset tummy, opposed to having to take medication every day for HIV, it's a good trade-off. If you're going to get PEP, you need to get it within 72 hours of having that unprotected sex. The earlier, the better. If you're getting it after 72 hours after you've had sex, it's just not going to be effective. For it to be more effective, you need to go as early as possible. And don't make the mistake of trying to call the gum clinic or the sexual health clinic to book an appointment. Literally just go to accident and emergency, because it is an emergency and it is a ticking time clock. So don't bother with appointments, just go to A&E. You do not need to take PEP if you've had unprotected oral, because as I've said, oral is kind of almost the safest type of sex you can have, apart from having sex with yourself, obviously. So they will say that that's not high enough risk. There's less likelihood of you getting HIV from oral sex, even if it is unprotected. So they're not going to give it to you if you've had unprotected oral. Unprotected anal and vaginal, though, absolutely you can get PEP. If you're ever really struggling, maybe you're stressed out about getting PEP, or you want more information, or you just want a bit of support, you can feel free to call us at Rainbow Project, or send us an email, or even just drop us a message on our social media, and we'll try and walk you through the process. But really, it should be a simple in and out thing. I think even at the most busiest times in A&E, the most I've ever heard someone waiting for PEP was about 4 hours. So if you're going to get PEP, as always, I'd say bring a book, bring something to watch, maybe bring a magazine to sit down and wait. But they will get to you, and it really is. It's amazing medication, and you know, it's human nature. We all make mistakes. I mean, I'm the sexual health person, and people often think that I must be, you know, a saint, but I am not. I am by no means a saint, and we all make these mistakes, whether we've been out drinking, or the person's just super hot and we're too nervous to ask them about wearing a condom. These things happen. Don't feel embarrassed or feel ashamed. Go get that medication. That's absolutely what it's for, and it is pretty easy to access as well.
Thank you so much, Leo. So there's a few questions coming in from the chat room here, so that's good. Keep those coming. Anything arises. Next question is about the hierarchy of infections. So aside from HIV, what are the next most prevalent should we be worried about?
I think, probably the most prevalent in the community is syphilis, gonorrhea, and chlamydia. But you also, I mean, getting an STI is not a pleasant experience, physically or emotionally. But syphilis, gonorrhea, and chlamydia, they can all be cured with a treatment of antibiotics. So it is not the end of the world if you get any of those infections. And I really think they're just so prevalent because they're just the ones that are very common. Syphilis tends to be more common in gay and bisexual men, and gonorrhea and chlamydia kind of affect the entire world as much as it affects everybody. They're just very common. They're almost like whenever I'm testing and I ask people about their previous STI status and someone says, oh, gonorrhea, chlamydia, I'm like, oh yes, the common cold of sexual health. Everyone's had a bit of it. I think that syphilis is one to be thoughtful of, because like I mentioned before, when syphilis, in the early stages of syphilis, you will get, or the person will get a painless sore in and around your genitalia. And that sore is contagious to the touch. Not if you just touched it with your hand and then washed your hand, you'd be fine. But if you touch that sore and then touched a really thin part of your skin, like your eyelids, your ears, your nostrils, your lips, then that STI can go through and infect you without any blood or bodily fluids exchanged. So I think that's sometimes why syphilis is so common, is because, many of us don't use protection for oral sex. And if you're not wary of it, you can absolutely totally miss it and just think it's a normal mark on someone's body. But they're prevalent, but they're by no means life-threatening. I think the most difficult thing about getting an STI is the psychological impact that it has. We often really we shame people in society for having an STI. It's really ridiculous to me because, I get chest infections constantly and no one ever is terrified to sit next to me. Maybe now during COVID, if I start coughing, that's a bit worrisome. But very few people would get upset or irritated or annoyed by the fact that I suffer from chest infections. But when nobody would think, disgusting, what a dirty bastard. No one would think that. But because it's a sexually transmitted infection, our society is just so terrified of sex. I mean, I'd say Northern Ireland is particularly terrified of sex, but I'd say the UK and Ireland in general doesn't always have a great view of sexual health. Yeah. And that's really the, you can cure those STIs and their symptoms entirely with antibiotics, but that feeling of feeling dirty, of, oh my goodness, what a mistake I made, I'm such a silly person, or even that fear of being like, oh God, that could happen again, that I think is the most difficult thing among STIs.
Well, that leads me on to the next question. I've had some risky sex and then I go and had to get antibiotics from the dentist for a gum infection. Have I found a cheat, a life hack that I don't have to go through the shame of the gum clinic?
I wish, wouldn't that be handy?
Wouldn't
it really, it very, very much depends, because antibiotics is not a one size fits all medication. Antibiotics has several different strains that are used for different infections. And I may be a sexual health professional, but a doctor and a nurse, I ain't. So I couldn't possibly even begin to understand all the complexities. But if you've gotten antibiotics for a certain condition, maybe like a toothache or something, and then you realize you've gotten syphilis, I would still say you absolutely need to go either to ourselves to get a rapid HIV and syphilis test, or to the gum clinic where you can get referred on for treatment, because that antibiotics that you were taking may not be the antibiotics you need to fight that infection. But also, antibiotics needs to be taken for a period of time for it to really kill the virus that's in your body or kill the infection that's in your body. So maybe, you had that toothache, you've been taking that medication for the last 2 weeks and your syphilis only showed up in the last couple of days. that antibiotics might not be enough of a course for it to kill that infection. So I don't think there's a life hack. It would be great if there was and we could double up on things, but you absolutely need to make sure with your GP, with your sexual health nurse, with someone at Rainbow, that you're getting the medication that you need, because we don't know really
Sorry,
what's
guys.
necessary. Sorry,
Off to the
no
gum
life
clinic.
hacks. Yeah.
Off to the gum clinic it is. There's no exceptions. You can't cheat and go to the dentist. Okay. One last question, Leo, and then we will go to questions from the participants. So the last question is just, is there a recommendation on how often we should be tested, how regularly?
Well, I would say off the bat, everyone should be getting tested at least once a year. I always say to my clients, pick a time of year that you remember. For a lot of people, it's Pride, to my detriment, because then it means I'm so busy during the month of August and September. But pick a time of year and always get tested around that time. Even if you are in a long-term monogamous relationship, I would say that you still need to get tested once a year. You can only ever be responsible for yourself and for your health. And I don't want to be like a Debbie Downer, but obviously in my job, people come in for tests when, you know, a monogamous partner of many years has maybe been sleeping with other people unprotected and the partner has had no idea about it. And that's a terrifying situation to be in, both because, you know, that trust and that bond that you have in that relationship is really strained now, but also you don't know, maybe I've been sitting with an STI for the last couple of years, maybe I've contracted HIV, who knows? And it's a very scary thing. So I would say you need to do it at least once a year. Not all STIs have symptoms. In fact, a lot of them can be entirely symptomless. So you may not even know that you have an STI. So it's important for you to get tested at least once a year, if only just to get the free condoms in the crack. Do you know what I mean? But other than that, if you are someone who has a lot of casual partners or you have a lot of sexual partners generally, you might want to bump up that testing from once every year to once every 3 months, because if you're having more partners, then there's more risk of you getting an STI. Obviously, if you're a super careful person who uses protection every time, that doesn't mean just because you have more partners that you're more likely to get an STI, but it is still a risk. So if you're having lots of different partners, I would highly recommend getting tested every 3 months.
Perfect. Leo, thank you so much.
No
That
problem.
concludes all of the questions from myself. We've got a few questions now from participants, so I'm just going to stop the recording and then we'll have questions from participants.